time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
So let me tell you a story, folks. A friend of mine who got sick wasn't doing well, went to the hospital, and unfortunately, the doctor told the family, you got about 6 weeks. And so went home, and they got hospice. That was 6 months ago. I don't know if he's going to continue on for years, but hospice came in, and they just did a great job. You know, had a will to live. He has extra days to talk to his children, talk to his grandchildren, talk to his sons, talk to his wife. So every day is a blessing. Sometimes we don't appreciate those days, but these days are great days for people, and we got to thank hospice for doing that. Today, folks, we're going to talk about hospice. As you know, I'm on the board of Hospice of the Sacred Heart, probably one of the finest hospice, with all due respect to everyone else, I think, in the country. And I have the founder and president here, Dr. Frank Bucci. I have the chief executive officer, Diane Baldi, and I have the medical officer, Dr. Ralph DeMario, and you couldn't find three finer people. Well, first, let me start with you, Frank, if you don't mind me calling you Frank, because you know, we go back a long time. When you and I talked about 12 years ago, you had this vision about hospice, and you know, it was a sincere, honest, from the heart, I want to help people. You put your own money into this. What made you want to just establish the hospice?
Well, the real first impetus is that I had a personal, you know, I'm not going to get into the details, a personal inspiration from heaven that was actually invited from the other side to start a hospice. And I just like to jump to when I ended up meeting Diane and presented to her how I wanted to take care of dying people. And she kind of looked at me and said, well, that's how hospice should really be done. And so there was two people with an idea, you know, the old saying, two people gathered in our name, you know, I am there. Now we have 105 employees and have taken care of 7,000 dying people in the past 12 years.
So you had, you know, you actually had a vision or from heaven,
yes,
and just indicated that you should be taking care of dying people. Okay.
Correct.
Then you went and you have, you know, we have the best here, as I said, Diane, who is what made you decide to go with Diane, who is now the chief executive officer?
Well, now that you ask, I'll try to tell the story quickly. I was operating in my eye center, and I had a nurse that was working part-time, and she said, you know, I'm volunteering doing hospice in the weekends. And I said, well, you know, I'm thinking of starting a hospice. And I was going back and forth from one room to the other, and I told her a story about how I had visited a monastery to pray like 25 years ago, and long story short, within a couple of cases, she says, I think I have a woman who's just left the hospice, and she would really like to do it the right way. And the story went on, and it turned out this monastery I went to was on Mount Baldi in Los Angeles.
Wow.
And when I told her the name, she goes, that's the name of the woman I want you to meet. I literally, after finished surgery, called Diane on a Wednesday. We had dinner on Thursday night, and she went back and told her friend, either he's completely crazy or he's a very inspirational guy, and we're going to move forward. Mm-hmm. And she found out that I'm crazy, but you know,
well,
we still were successful despite that.
So then, Diane, when you came into the picture and he was telling you about the vision of what he wanted to do for hospice, and you were involved in hospice and have probably one of the best reputations in the industry, what was your thoughts and feelings?
Well, it was very interesting. The friend that Dr. Bucci was referring to was Dr. DeMario. That's whom I call, because Dr. DeMario and I had worked together with another wonderful hospice organization for about 15 years together. And at the time, I was very happy. I had done kind of everything in hospice. I'd been a case manager. I had been a director of patient care. I opened an inpatient unit. I was very content, and I loved the work I did and I was doing at the time. And Dr. Bucci called, and just listening to his passion, and because I think personally I may have lost that over those years, or there were just kind of maybe some things that I wanted to do that just weren't possible to do in hospice, and that certainly opened the avenue for it, because I'm guilty, and I don't think it's a bad thing to be guilty of it, being a huge patient advocate, and for families and patients as well, and that certainly afforded me, you know, the opportunity to do that and kind of do hospice the right way. And so when I thought about it, I had another good friend, and I was telling her about it, and she said something. I said, I've been here for 15, 16 years. I'm not sure I should make the move. And she said, well, think of it this way. When you're doing your pros and cons, would you regret in 10 years not doing it, not pursuing it? And that's what sold me. So Dr. Bucci and I met again, and maybe 6 or 7 weeks later, I made the move. And really, in the very beginning, I thought, there was many days in Dr. Bucci's office, I thought, what have I done? It was just the right thing to do. And then over the course of time and a lot of prayer and a lot of good luck, we came to be. And then the rest is really history.
Getting back then, before I get to you, Ralph, getting back, Frank, how did you determine the name Hospice of the Sacred Heart?
Well, many people know that my wife was a saintly woman and had special gifts, and her devotion was always to Sacred Heart of Jesus. And she, from a little girl, he would appear to her throughout her whole life. So in my life, my time with her, it was always devotion to the Sacred Heart of Jesus. So it was very easy to pick the name.
So in building up the hospice, okay, you start building the hospice up. Then we come to Dr. DeMario, whom we definitely wanted to get on board. Now, what I'd like for you to explain, Doctor, for people who are not that familiar with hospice, other than people who've been involved with hospice, like my family was, we totally understand, and this person who I just mentioned, they totally understand. But some people, how would you describe hospice, and when do we need you?
Sure. Well, we always talk about hospice being for patients who have some type of a terminal or advanced illness. And, we try to get patients and their families involved as early as we possibly can. Usually, from an insurance standpoint, we look at about 6 months, but there's no exact number. When patients have decided they don't want any longer want either curative treatment, don't want to continue to go back and forth to the hospital or the emergency room, that's usually a time that we start to say, I wonder if there's another level of care. I wonder if there's another group of professionals who can come into my home, help take care of me, whatever my illness is, whether it's cancer or heart failure or dementia, and help me get through the next 4, 5, 6 months of my life, and also support my family to help me get through that as well.
Okay, now you were a very successful doctor in your own practice, okay? And then you decided to come on board with us full-time.
Sure.
Okay. You crazy?
Well, no. As a matter of fact, I think it was very, very similar to Diane. At first, again, I had been in private practice for 21 years. As Diane had mentioned, she and I worked together at I was on a part-time basis. She was full-time for another wonderful hospice. But at one point, Diane called and said, we're looking for other experienced people who are going to join the journey, so to speak, of Hospice of the Sacred Heart. And we're looking for some people who are particularly enthusiastic and have some good input referable to hospice and palliative care. And would you like to join that team? I did it part-time to begin with, and now it's been about 6 years that it's my full-time job. So not crazy. I think it was just another path that led me to do something else with my life.
And I say that respectfully because, it's not money, okay? It's a matter of that, we have 3 people here, and you have the people that are on hospice, and I'm not just telling you this, folks. I'm involved with them. I'm on the board from day one, and like I said, there's a lot of hospices around, and God bless anybody who's involved with hospice because they're special, talented people. So with that being said, but the dedication, Ralph, that you brought in the training, okay, and the sincerity, which I've seen at board meeting after board meeting, it wasn't fake, it wasn't phony, it wasn't trying to make the board members feel good, but you speak from your heart, and so do you, Diane, and say that, Frank.
Yeah, I just want to make a point that Ralph's ability to manage pain, his pain management is second to none. And just in general, his devotion to our hospice for the past 9 or 10 years is an integral part of our success.
So we're going on 12 years, you
Yeah.
said, okay, and you looked at the thousands of people that we've been able to service, okay. Diane, what do you attribute, and I'm knocking on wood and thanking the good Lord, what do you attribute the success of Hospice of the Sacred Heart? Folks, we put the number on the screen and the website. Please check them out. What do you attribute that success to?
I think there's a couple different answers to that, Sam. And when I look back on it, as I said earlier, that it'll be 12 years now this year for me. I didn't do it myself. I certainly didn't do it myself. I had great effort, and certainly I have 2 board members here. Certainly the board has always been so devoted to do it. Just go ahead, whatever it takes, take care of our patients and our families, take care of our staff, and very supportive of all those decisions along the way. But also, I didn't do it by myself. There was incredible other members of leadership, members of our management team, members of nursing. The real guts of that belongs there with them. There's been many changes over the past 12 years especially, certainly regulatory changes, a lot of scrutiny, but at the very basis of all of it is kindness and compassion and quality of life, layered also with Ralph's ability and certainly other members of our medical team to provide wonderful pain management and symptom management. But I really believe the staff across the board is responsible for that. They go in every day, they're giving 150% every single day. And I think that, certainly the management piece of it, my job may be difficult some days, their job is truly, every minute they're just devoted. I would credit our staff and the education of our staff.
You find from the top things filter down, okay? And I guess this is a good thing, Frank, or a bad thing when I'm in business. I always like to put people to the test, see if I can trust them, okay? And I don't want to leave my secret out here, but, and especially if you're going to dedicate taking care of people who are sick, okay? I didn't want anyone playing games. I didn't want to have that. So I put Diane to the test. She passed. I put Ralph to the test. He passed. I put another person, I can't think who it was, to the test in my own way, and they passed. And I saw the sincerity, I saw the care, and it's just not just talking about it. We're going to read some testimonials, but we got thousands of testimonials. My mother, yes. Okay, and now it hits home. Okay, it hits home. Okay, and again, with all due respect to other hospice is Sacred Heart, second to none. We're number 1 in the area for hospice. And Frank, that doesn't come overnight, does it?
Yeah, I just like to point out that from Diane down, Diane's vision of what compassion is, and the fact that from the very beginning I focused on giving and asking nothing in return. We are actually, we don't do well at fundraising compared to other nonprofits because we haven't really asked anything from the community. We humbly and gratefully accept whatever they might offer, but our focus was on, I recently at a volunteer luncheon, I told them, you are the extension of God into the homes of the person who's making that passage from this difficult illness to be swallowed up in the light in a short period of time. And you're God's hand on these patients, giving that unconditional love, and it's a preparation for the passage. Many patients have lots of fear, other patients don't have a lot of fear, but we take care of everyone the same way. And by delivering that unconditional compassion is what hospice is all about, and I think that's the basis of our success.
I think that's beautiful, Frank. What you just said, the extension of God's hand. And I wonder how many patients we had, we call them patients, or
sure.
Patients we had that were fearful of what they had. And then when we went in as hospice of the Sacred Heart and be able to comfort them, etc., and how that work that they were accepting, Yeah. Ralph, I guess.
Yeah, what came to mind is, you had mentioned that we see thousands and literally thousands of satisfaction forms and accolades and memorials, and clearly across the line, across the board, the number one thing that we get from patients' families who are left after the patients have died was, I wish someone would have told me about Hospice of the Sacred Heart earlier. I wish there was someone to help control my mom's pain a little bit better, or provide support to our family members, or send in that other volunteer, or I didn't realize that you had this beautiful inpatient unit, that if we got into a crisis, we can use that for 3 or 4 days to get mom's seizures or bleeding under control. So I think that's an important point, to bring up, that whole issue of, we talk about what we do, we just sometimes wish we could always do it as early as possible.
And that's key. Folks, I'm talking to Dr. Frank Bucci. You know him, you've seen him on TV. He's on Eye Care Today with Dr. Kislin. Leader in the country, what he does. I taught him everything he knows, which is great. Dr. DeMario, who is the Chief Medical Officer of Hospice of Sacred Heart, and Diane Baldi, who is the Chief Executive Officer. Come back, we'll talk about the inpatient unit we have, and plus a little bit more about the different services we have. It just doesn't end with going to taking someone in the home, but there's other things that they participate with. Stay with us. Welcome back to the Sam Lesante Show, folks. Thanks for tuning in, and thank you so much for all those great emails at sam@ssptv.com. And remember, you can watch all of our shows, every one we produce, on our website, ssptv.com. My guest today from the Hospice of the Sacred Heart. Put the phone number on the screen, Sam, and the website. Hospice, we've been involved here going on 12 years. Dr. Frank Bucci, who is the founder and chairman of the board, and was responsible for me to be able to read these notes, because what did you do for me? You gave me implants, right? Multi, could see these clear as day. Normally I say I can't see this, but I can't do that right now. And Diane Baldi, who is our Chief Executive Officer, and Dr. DeMario, who is the Chief Medical Officer. Let's talk about the inpatient facility we have, Ralph.
Sure, Sam. Well, you know, the number one thing that we do for our patients is take care of our patients at home. And about 95% of our patients truly want to die at home, surrounded by their families and their loved ones. But, you know, we did notice a number of years ago that we were sometimes getting into crisis situations where patients were completely out of pain management that we couldn't take care of in the home environment. Maybe they were having seizure activity, terrible bleeding, significant shortness of breath, those type of things. So one of the things that we started talking about was possibly having our own inpatient unit where we could actually take care of patients, again surrounded by their families in that particular space, until we got those symptoms under control, and then they could return back home. And we're so pleased to say that within the last 6 months we were actually able to make that come to fruition.
One of the things I highly supported, as you know, at the board meeting, bereavement services, okay? We talk about, there's a lot of things that we do that help people, okay? And unless you're in that situation, you can't appreciate what we do if you're not, when you're in that, then it's so valuable to you. Let's talk about our bereavement services.
Bereavement services at Hospice of the Sacred Heart, I will say this, Sam, that they truly are second to none. The requirement is that you would provide bereavement services for families up to 13 months after the patient has died. But you don't get reimbursed for that. So, of course, we took it to another level, because that's really, we take care of patients and families. So when the patient dies, the families are left, and they need some guidance and direction. So we have so many incredibly wonderful bereavement support services, headed up by our Director of Counseling Services, Mary Lou Kidd, who truly is a bereavement guru. We have programs for children who have suffered a loss, programs for widows and widowers. There's 6-week camps. We have support groups. Everything is free to the public. We just received a wonderful grant from our friends at New York Life for our Dragonfly program, which we're going to also extend to a bereavement day camp for children. So it's more than just writing, a card, an acknowledgement. We really work with individuals who have suffered that loss, and unless you've suffered it, you really don't know. So it has helped so many people.
And I could just imagine the people, Frank and Ralph, that when they go to these services and what it means to them, how they cope with that. I mean, here again, unless you're in that situation, you can't appreciate it until it hits. And Hospice of Sacred Hearts have been there to provide all of the things that are necessary, Frank.
Yeah, again, it's worth emphasizing that we help the families as much as we help the person passing.
Important.
As the person begins to confront so-called death, it makes everyone in the family think about that, plus their relationship with the person. Right. So by taking care of the person, it gives them a vehicle for dealing with the fear. Whenever you can reduce fear in either the patient or the family members, it helps the quality of life completely.
And I think that's some of the concerns that, my mother wanted to go. I mean, she was comfortable after I said it was okay for her to go. I mean, people think that's stupid, but they want to be told, and I just saw a whole different, I felt good, not that she was passing, but the fact that she had just that last couple, days that, we had hospice. And that's why I believe in hospice so much, because I've seen, I don't know how you, Ralph, or you, Diane, and all your staff, which are great, can do this, because I'm a big baby. Well, I'd be crying every day. I'd be crying every day.
Yeah. I think my answer, people ask me that very often, because actually Dr. DeMario and I have been doing this for 26 years this year, I believe.
It's a long time.
And I started out, as I told you earlier, a registered nurse. So at this time, to me, I can't imagine doing anything else, because it's actually the opposite, Sam. because it's more of a ministry, a calling to do this. You actually take people who are at their worst possible time in their lives and help them. So you receive a lot of benefits yourself for that. So I can't imagine doing anything else for that. And I think Dr. DeMario feels the same way when it's not hard work. It's,
I agree. And you also have to have good self-care.
Right.
We were just talking about this actually on the way coming in. You need to take time away. You have to prevent them from getting burned out. Use some other people that you can delegate some of the responsibilities to, because you can't do it 24 hours a day, 7 days, because you're exactly right. You could get a little bit burned out. So you need to step away from it every once in a while as well.
My wife's a registered nurse, as you know, and she feels the same way you feel. I mean, I don't know how she, you look at things a little differently, and my wife will look at things a lot different than I do. Okay, and I'm blessed to have her because she has perspective of life sometimes, and I think registered nurses or anyone in medical, not necessarily registered nurses, but LPNs or whatever, anyone who's in healthcare. Frank, so when we're looking at the success, and you put together a very solid board, okay. And I'm very humbled to be on your board because we have great people on that board who feel the way I feel and are dedicated to what it is. It's just not going to a board meeting, okay? And they be, I'm proud to be on the Hospice's Sacred Heart board because I know what we do, okay? Even though we meet 4 times a year, but Diane keeps us informed. When you were putting together the board, what were you thinking of?
Well, you want to get good quality people that have an understanding of what your mission is. And it was interesting. I'm not a real network guy, so it was like all the patient, most of the board members came as patients or friends of a friend. And when we said we're going to start a hospice, they kind of showed up. God put them on the doorstep.
Yeah.
And we're lucky to have people that I say, some of them are very wealthy people. I say, I don't want your money. I want your compassion. I want your decision making. I want your understanding. I want, you to be able to help us as an individual. And we've gotten that all along the way.
And you have diversity on the board, and it's not like a yes. We don't, as you know, we just don't know rubber stamp. But there's such creativity on the board, and everyone has a talent to bring to us. Okay. And, we take it. Sometimes we agree to disagree, but the point is we're all together and we support the final decision. And I think that's important in Develop the Hospice. So, we're, to grow to be where we are today, okay, going on 12 years, and servicing over 7,000
Almost
patients,
7,000.
okay?
And just think, Sam, we send almost 69 nurses to 9 counties. Started out just 2 people. So again, I always believe the divine hand is there. The board members the key thing about the board members is that they understand the mission. And we're doing it before them. And in the beginning, when it was a tough start, and I literally said, you're going to observe a miracle here. There were times when most of the board members didn't think we were going to survive, and our patient census increased because we kept doing the right thing, and God will reward us.
Not to raise a flag here for me, I never doubted that we would grow. And never doubted in one. Believe me, never doubted that. To see, with Diane and Ralph and the great, I wish I could name all of them. Okay, fabulous workers and dedicated from A to Z. And that's what hospice is all about. Ralph, just to conclude, tell our viewers again why hospice is important when you need them, and when do I need you?
Sure. Again, just to reiterate that, Sam, it's always important to think when there isn't any aggressive treatment that's required, there's no further curative treatment, or you just have patients who are advanced stage, in advanced or terminal illness, and they need good pain and symptom management and would like to stay in their home. They don't want to continue to go back to the emergency room, don't want to go back to the hospital, and they need a team of professionals, of nurse practitioners, physicians, nurses, volunteers, social workers, counselors who can support the patient and family, keep them at home, but keep their symptoms under very good control.
And Frank, in conclusion, what do you think? What would you recommend? Why they should come to the hospice, to the Sacred Heart?
Well, just to follow Ralph's point is I think the typical daughter or son at age 50 or 60 is taking care of their 80 or 90-year-old parent ask, is hospice available for my mom or dad? They don't think they're ready. They think they have to be on death's door.
Yes.
But the service is available earlier than they think. So the key message is ask the question. And then, we pride ourselves on giving the best possible care.
Yeah, and then, you could even ask the question of us, Sam, quite honestly. Much like Doctor said, if you're not even sure from your physician, please feel free to call the number. We're more than happy to talk to patients and families at any time to guide them on that journey.
Well, let me say this, Diane, in conclusion. I'm very honored to be on the board. I'm working with great people. You're dedicated. Your entire staff. I've said this 100%, even at board meetings. Please tell the staff that on behalf of the board, they're fabulous, okay? Frank, your dedication and it just went beyond. I mean, I remember times when you put your own money in to make things happen and didn't ask for anything, never asked for anything, just gave and gave. And I think that's why you're so successful as the leading eye surgeon that you are in the country, Frank. It's an honor to be with you. And Ralph, you're just a gem. I mean, you're just fabulous. What you brought to our hospice board is just fabulous. Thanks for coming on the show. I hope we educated a little bit, folks. But listen, just go to their website, hospicesacredheart.org. You'll learn a lot. And like Dr. DeMario said, call them if you have any question. Phone number is 706-2400, very easy number. They're more than happy to give you honest information. We'll see you next time.